Let's talk about the UK's vaccination rollout program. It is obviously an ambitious one. The Prime Minister has admitted it. The Health Minister has said that it won't be easy, but they will try to get it done. They're hoping to get 14.6 million people vaccinated by middle of next month.
That's right. The priority that has been outlined by an independent advisory board is that the highest risk individuals, particularly the elderly, together with healthcare workers, are in the phase one of this rollout of some 15 million by February. A very ambitious target. I should say that the Queen and Joan Collins classify as high risk purely because of their age, not because of any other status they have here. To date, something like just over 1 million doses have been given, primarily of the Pfizer vaccine. The AstraZeneca vaccine has just made it into GP surgeries and vaccine centres this week.
So, I mean, it is an ambitious target, as we both say. Do you think you'll be able to do it?
Well, I hope so. I have to say that the UK government response to COVID has not, they've not covered themselves in glory to date. There's been a continual battle between taking effective public health action against the perceived risks to the economy, not unlike the debate that's been going on in your country, in South Africa. Having said that, they are yet again in the midst of a disaster here. We have just hit the 100,000 deaths over the last couple of days after the chief science officer said right at the beginnings of the pandemic that if we kept it under 20,000, that would be a good outcome. Well, it's clearly not been a good outcome. So at the same time as there is vaccine rollout going on at the moment, there's also record numbers of infections. Again, we're seeing this resurgence as you are, particularly with new variants that seem to be more transmissible. So it is essential that we do get the rollout underway. Having said that, and as we've learned around the world, the response to this is not just single-pronged. It's not just the vaccine coming to save us. It is a whole range of public health measures, social distancing, essential services open only, and of course a very good testing system which allows people to be identified as potential transmitters and to isolate them and to support them to isolate. All of those things will be important for the next months.
Current events, developing stories,
tough questions,
your voice making a difference.
This is Breakfast with Bongani Bingwa.